introduction to the Jackson flat top traction device, which is a lightweight, versatile, and real user-friendly device for applying traction on the flat top table for fracture fixation in the acetabulum, the pelvis, as well as the femur. And so here's the device just as it comes out of the box, and you can see how lightweight and compact it is. Basically, it consists of a bracket by which it attaches to the flat top table, and then a rail through which your traction rope can be applied. The rail is able to slide up and down. It's able to lock and unlock just with a twist of the wrist, and it's also able to rotate. And we're just going to review the setup of the device here. So here's the bracket by which the device attaches to the table, and you can see that it's spring-loaded, and there are two nipples which help to secure it onto the table. There is a bolt which actually can be inserted into either side of the bracket, depending on which side of the table you'd like to set it up on. So again, we're going to set it up here on the right side. So what I'm going to do is align the nipples on the bracket with the holes here on the table. And those have a nice fit there to help secure the device. Then what I'm going to do is start to thread the bolt into place. So now we're going to focus in on the rail component, and this is the area through which you can run your rope that you're using to apply traction. And you can see that this pivots freely to allow at least some freedom of motion of the limb while in traction. The device also moves up and down, again, to facilitate fracture reduction. So you can see here, the up and down is currently locked with the red on red dots. So if I want to adjust that, I slide it to the green dot, and now that's unlocked. And that will go up and down in a controlled fashion. You can see if I leave it there, it won't come crashing down. It will just stay there. And then with some force, it will slide on its own. And then again, at the appropriate height, that can be locked, but will still allow for rotation. And depending on the application, you may want different heights and different trajectories. If you're going to use this device for a retrograde nail, oftentimes you'll set the height a little bit higher. If this is going to be used for the pelvis, the acetabulum, or an antegrade nail, typically it can be set a little bit lower and secured in that way. So here's just an example of how you might set up traction. We of course don't have a patient here today, but one end of your rope is attached to the patient, and typically for me that's using a distal femoral traction pin with a traction bow. That can be either sterile or unsterile, depending on your application. Once that one end is attached to the patient, all that you need to do is run the rope through the rails, and then an unscrubbed assistant can adjust the weights as necessary. So that's a nice example of how versatile it is. So in an unsterile application, this is exactly how I would set it up. This also can be draped sterilely into the field, and the way that's done is to cover it over with an impervious stockinette, and then again that can be a sterile part of your procedure.